Hello everybody, Namaste. I'm Dr. Mandeep Malhotra. I am the Director for Oncology at CK Birla Hospital in New Delhi. So this is the Ovarian Cancer Month, and we in our effort and process, we are trying to raise the awareness around ovarian cancer. Ovarian cancer actually is called as like silent killer because it is majority of times it is detected at a late stage, and also over the time over these past few years ovarian cancer incidence has increased. Now around 30,000 33,000 is the annual incidence of ovarian cancer in India, and it is not in 60s 70s, it is around 50s that we are seeing majority of women who are getting ovarian cancers. And there are certain myths which surround it. First of all, the first myth is that it's a disease of old age. No, it's not a disease of old age. It is actually around 50 years or around 50 to 60 years where we are seeing maximum patients who are getting ovarian cancers, and 50 at today's time is a young age because woman is just at middle age and she has the whole life ahead of her. Secondly, that pap smear is a test for ovarian cancer. No, pap smear is actually not the test for ovarian cancer. It is the test for early detection of cervical cancer. For ovarian cancers, the test is majority of times when we are evaluating ovarian cancers, it is through the ultrasound, that is specifically transvaginal ultrasound, pelvic examination and CA-125. Another important fact is that and this is like any ovarian cyst, we feel there's an alarm raised that this is an ovarian cancer. It might be even in very young females. So majority of ovarian cysts are not ovarian cancers. Majority of them are functional ovarian cysts which vary between the menstrual periods, which can increase or regress according to the periods. Secondly, a majority of cysts are actually benign ovarian cysts which can be followed up, or they require a simple surgery. It is in, I would say, around 15% of the cysts which are actually concerned, and that too we can have an early borderline ovarian cancer and then an advanced ovarian cancer. So yes, I am not saying cysts should not be evaluated. They should be evaluated if needed. If any suspicion, they should be kept on follow-up, and certain evaluations like ultrasound, CA-125 should be done. Another thing is that ovarian cancer is not hereditary yet, or it is only hereditary. No, around 20% of ovarian cancer is actually hereditary. The rest of it is not hereditary, and by hereditary we mean that it runs in the family, that it can pass on from mother to the daughter, or it can assist a woman's sister can also have the ovarian cancer. And if there is any history of breast cancer, pancreatic cancer, peritoneal cancer, sometimes thyroid cancer in the family, we should first meet a genetic counselor. The genetic counselor which will evaluate the actual risk and then suggest that certain tests like BRCA1, BRCA2 should be done or should not be done to evaluate the hereditary risk for ovarian cancer. Last fact is that when we are talking about that, what are the signs and symptoms? Because this is actually majority of times we miss ovarian cancer. So sign of symptoms is like any dyspepsia, change in bowel habits, or bloating, or loss of weight, or pain in abdomen, specifically lower abdomen, or erratic bleeding through the pervaginum, or there is fatigue. So these symptoms should be evaluated, and evaluation like pelvic examination, ultrasound abdomen, ultrasound transvaginal ultrasound should be done for evaluation that is any such disease of ovarian cancer should not be missed. Thank you.